Once again, welcome everyone to the launch of the Community Minds platform. I'm Crystal, for those who just joined on, and I will be your facilitator for today. On screen is the agenda for today, and we will have Professor Dixon Chibanda speaking and Jean Turner. It's always a great honor and pleasure to speak to like-minded people who share a common vision with us. So we're very excited about that, and we're very excited to have you on board today. At this moment, I'd just like to take the chance to ask everyone if it's okay if we can record this session so that we can always upload it on the Community Minds platform for people who are unable to be here today. And just a reminder, could you kindly just mute your microphones until the end of the session, where we'll have the question and answer segment. But during the course of the meeting, if you have any questions that do pop up, please feel free to send them through the chat box, and we'll attend to them at the end of the meeting. At this point, I'll introduce our speaker for today, our first speaker, who's Professor Dixon Chibanda, the CEO and the founder of Friendship Bench. Over to you, Prof.
Thank you very much. Thank you. So my job really is to just welcome you all. And sorry if it's a bit dark, but I'm sitting outside and the weather's just beautiful here. So I want to take this opportunity to just welcome you all to Community Minds. But before we get into the nuts and bolts of Community Minds, I'd just like to briefly give you a little bit of an overview of where we are coming from. Now, the Friendship Bench is primarily known as an intervention which is delivered by trained community grandmothers on these sort of wooden park benches. But, over the years, we have realized that other members of our communities who are not trained, in fact, members from the global community who are not necessarily trained in what the grandmothers are trained to do, have a significant role to play in narrowing what we call the treatment gap for mental, neurological, and substance use disorders. They can contribute in their communities in the prevention, identification, and even referring those that need help from evidence-based services. And this is what we're really here for. We're all here because we have a common vision. We want to create more mindful, resilient, and empowered communities. Through learning more about mental health and the enormity of the effects that it has on individuals, families, and entire communities. So we're all here to try and teach each other how to create safe spaces where people can find a sense of belonging. The COVID pandemic has resulted in fragmentation of human connections. But I think through this platform, like Community Minds, we can recreate that sense of belonging. We can give people a sense of purpose, guided by our values of connection and empathy. We entail to strive to be non-judgmental, and we actively listen to people and honestly share with people that mental health problems are serious and that each and every one of us can do something about it. So with those few words, I'd just like to welcome you all to Community Minds, but you're about to hear a lot more about what it is, what are the nuts and bolts, and what is this journey going to be the next couple of months, hopefully couple of years, where we will all work together to try and contribute towards making our communities better communities. It starts with each and every one of us in our respective communities in order for us to make the world a better place. Over to you, Crystal. Thank you.
Thank you, Prof. At this moment, I'm going to hand over to Jean Turner, who is our Media and Communications Manager, as well as the brains behind the Community Minds platform. Over to you, Jean.
Thank you, Crystal and Dr. C, and to everyone who's joined us tonight. It's such an honor to be able to sit here and present to you. And like Dr. C says, just that everyone is here with a common vision and wanting to make a difference in this world is something, it's heartwarming, definitely very heartwarming. So I'm a very visual person, and I've made a little slideshow that's going to explain the sort of the process that we've gone through to get to where we are today. So I'm going to go ahead and start that and walk you through why Community Minds is what it is and why we're here today. And if anyone is worrying this little black dot on their screen, and if you're trying to clean it, stop trying to clean it because it's on my screen. So don't be worried about the black dot. Okay, so why Community Minds? I'm going to start with the levels of care and definitions of what we have today. So we, in Zimbabwe, we have a primary healthcare setting where the friendship bench currently sits. And this is pretty much open to anyone in their community. It's generally within walking distance for everyone. It's affordable care, and it is a level of quality that people need that's not available at home. And then secondary care, which is a level up, which could be a district hospital, where your care is getting a bit more specialist. And then obviously tertiary care, which is more specialist treatment. And obviously as you go up a level, everything gets more expensive. And we as Friendship Bench deal with mild to moderate mental health disorders, and we work with community health workers. So what's really important to us is to have referral systems. So we know that our primary health care can refer to our secondary, who can go to tertiary. But when we look at the definition of primary health care put out by the WHO and UNICEF, primary health care is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being and the equitable distribution by focusing on people's needs and as early as possible along the continuum, from health promotion and disease prevention to treatment, rehabilitation, and palliative care, and as close as feasibly possible to people's everyday environment. And so as we talk about it, we know that there's another level of care that we're not looking into, and that's the community care, which is everyone sitting here tonight. We all have a responsibility, but we don't realize that our problems don't arise when we arrive at a clinic. Our problems are happening while we are living in our communities. It's almost like we want to work on prevention, but we're not really, because by the time we arrive at a clinic, we already know there's a problem. So we are really working hard right now to move from even a clinic setting, going deeper into the community so that we don't have to wait for someone to get to a community. And we already realized with COVID that there was suddenly like we were deers in a headlight, because everything stopped working, everything shut down. And sort of we looked around like, where are people going to get help now? Because the clinics had closed, or the primary healthcare clinics had closed. And so when I look back at that definition, and it talks about whole of society approach, equitable distribution as early as possible, as close as feasible to people's everyday environment, we sort of started asking, is that really primary health care, or do we need to re-envision what mental health care and treatment looks like and at what level it starts? And so when we look at it like this, we say, yes, we do need to relook at it, because when people think of mental health treatment, often what comes to mind is therapy and medication. And I mean, there's no short number of articles in the media that talks about how people just get prescribed antidepressants. And I think there's a misunderstanding that if we go to therapy, things will magically get better. And we want people to see more that mental health is not therapy and medication. Mental health treatment and care is more than that. As you can see in the big circle, everything here in this list, I won't read through it all, but some big things like connecting with others, challenging negative thoughts, mindfulness, exercise routine. All these things are part of mental health treatment. But as long as people are stuck waiting to get treatment from a clinic, we can't help beyond that sort of sphere of influence. So we are really trying to get everything in this blue circle out to people. And we think to do that, all it takes is a willingness, awareness, knowledge, and empathy from everyone here, everyone in the community, family, friends, peers, work colleagues, it doesn't matter. And so we started to wonder, if we can wake up, which is, as I just said, willingness, awareness, knowledge, and empathy, if we can increase those, we can make a big difference in our communities. We don't have to wait on a primary healthcare clinic. We don't have to wait on an NGO. We don't have to wait for the government to come in. All of us can take part in in lifting our community resilience and improving mental health so that people have a better quality of life. And so that's where we've ended up here, which is why we have invited you all here today to introduce you to our Community Minds program. And hopefully if I click on this, it will take me there. And let me just switch my screens. Bear with me. So we have built the Community Minds platform, which is an online platform that is free for anyone. We require a sign up, but there's no fees, there's no dues, people don't have to pay anything. Basically, all we're wanting to put out there is content, psychoeducation, a way to connect with specialists beyond what a clinic setting would do, because we believe if our objective is to increase knowledge, decrease stigma, and direct people to a setting where they can get help, whether that be in the community, whether that be over the phone, over WhatsApp, it doesn't matter as long as we know that someone can connect with someone else when they need to talk. And we know one of the big barriers to getting treatment is stigma. So if we can increase people's knowledge and make sure they know that people aren't crazy if they've got mental health problems, and even just to be able to let people know that mental health is on a continuum. We're not saying you either are mentally well or mentally ill. What we're saying is that our mental health fluctuates. And if we can give people the tools and encourage them to engage with one another on how to cope when in struggles, when there's problems coming, we can build resilient communities without having to rely on a system. So what the platform does, I mean, it's very simple to sign up. I will leave a sign in at the end of this, but just to show you a few things, if you sign up, everyone will get their own dashboard, and you get your own profile, so you can like log in and out. And if you see, so what we're currently working with is, because we know there's a lot of youth online, we do want a component on digital advocacy. We want to have workshops and webinars. I just want to shorten my screen, sorry. Podcasts, workbooks and guides, campaigns and journals. So these are the core components of what we've realized is possible to easily get to a community, to easily share with people so that they can make a difference in their community. And so, for example, I'll start in our workbooks. And so every single one of those goes to another page where content is provided for people. And all this content has been designed from input from our we have quite a few research projects going at Friendship Bench, so sort of focus group discussions from professionals like Dr. Jabanda and Dr. Ruth. And then also there's quite a bit of content from user lived experience. And at Friendship Bench, as you know, the grandmothers we work with, we rely a lot on their wisdom, a lot on their years and years of lived experience. So we do believe that they don't have to be professionals in the community, because we could consider everyone with a lived experience in their own right. They are a professional. And we take their knowledge seriously, but we take and value what their opinions are. So if we're working to develop something, we want everyone's voices in there. And that's the same as what we've done to carry their voices into the content we develop. So any of these are clickable. I suppose I can. I hope my screen doesn't move. They would all be easily downloadable by PDF. They're all open for you to print. We would encourage and welcome everyone to download and share. We're not stopping you or saying it can only be used in this way or that way. We're really here to make sure that there's content available for people so that they can increase their knowledge. And help share that with people who don't have access to being online. So that's why all of it is also printable, because we know in our setting, not everyone can be online. And if we go back to the dashboard, so our workshops and webinars haven't yet been uploaded, because I think to date, we've got about 100 people or over 100 people who have already signed up. And we're going to be asking everyone what they want to learn. Because as we've done in our other development, we don't want to just make content for people that's irrelevant. We want people to be like, we want to learn this. And then we're like, that's wonderful. Then we can work and craft a workshop for people who want it, not just content for the sake of content. And these will also be available for the members. And there will always be recordings that are uploaded below here. So as soon as a workshop or webinar comes, you can then come and catch up with it. So what's here right now is past webinars and workshops. So you can still straight away catch up with those while we get our other content up. And the same with campaigns. So we've done a campaign on stigma, because that's the biggest thing we face. So each campaign, so for example, whether it's World Mental Health Day in October or World Suicide Prevention Day, we would like to run campaigns with the community. So again, when those are coming up, we'll reach out to members who sign up and say, who wants to be involved in crafting this campaign? And hold even some of our workshops could be focus group discussions, so that we really want everyone's voices. We realize that we know a lot about Zimbabwe, but as you could see in the chat, there's people who have signed up from all over the world, and we know mental health doesn't discriminate. It doesn't see age, it doesn't see race, it doesn't see gender, it doesn't see financial status. Everyone can be affected. So we want all the voices at the table when we develop our campaigns. Let me go back. And then this is something, journals, for example, this would be something that comes out monthly, journaling and mindfulness. It's something that I personally would, if people don't, I would say, I would encourage you to start journaling. And from personal experience, I know that therapy and medication, it's all wonderful, but that 1 hour therapy once a week can only go so far. I think there's almost a misinterpretation of what therapy can do for people, because what I've learned from therapy is I was always sent home with what I would consider homework. So a lot of work to do on yourself outside of that room. And I've found that people I've met in, say, support groups, it's the ones that go home and do their homework that seem to have a much longer recovery, whether that be from depression, whether that be from substance abuse. It's people who invest in themselves every single day that sustain their recovery and don't relapse. They adhere to any medication they're on. And I think that's something as individuals with a passion to make a difference in our community, we have to encourage that. And if a way to encourage that, because a lot of people will be like, yeah, I don't know what to do, or give an excuse like, no, I'm too busy. I think there's almost a responsibility in every single person to be there for others and to direct them to resources where they can get that help, or they can learn about tools, they can learn about breathing exercises or meditation. And yeah, so I don't think I have to go further into everything, because I think I've talked quite a lot. And I don't want to ruin it all for you. I would really like you to sign up and go and explore by yourself. And so, yeah, I think I'm going to stop there for now and hand over to Crystal for any questions. we really would like this to be a platform of engagement. And I know people straight away, you'd think like, but why is it not on social media? And I think part of the building and the thinking of that was that social media is already so saturated with content, and it's links to links to links. It's like going there and going down a rabbit hole. So it ends up very unfocused. And to try and get our minds into a more peaceful place, this is going to be hosted online. It could at some stage be a private group on Facebook. We would be open to what people's thinking is about that. But for now, for us, social media is just too saturated with everything under the sun. So yeah, what we have right now is the frame of the direction we're going in. And we would like to build this community so that we all can help each other build it and be able to reach everyone out there and make sure that everyone, if they need someone to talk to, they have someone to turn to who's understanding and empathic, and everyone can feel like they belong in the community they live in, which we're finding is not the case right now. Yeah. Thank you very much, everyone. And over to you, Crystal.
Great. Thank you, Jean, for such an informative and amazing presentation, as well as the initiative. You know, it's always great to rethink mental health. And I think my key takeaway from your presentation would be to think beyond clinics as the primary healthcare facilities. So definitely rethinking mental health. And thank you, Carol. And she says she agrees with you completely that we shouldn't be doing this through social media. So thank you, Jean, for that. And once again, thank you, Dr. C, for your presentation as well. At this moment, I'd like to open up the floor to any questions, either for Prof or for Jean. So feel free to use the reaction icon to raise your hand and we'll attend to your question. At present, I haven't gotten any questions through the chat box. So you know, you can go ahead and just raise your hand and you can ask your question. Thank you.
I'm going to put the sign up in the chat, but we will also, in response to the webinar, we will get back to you. Yeah. And I do see Layman Human. Hello, welcome. Nice to see you.
Hi, it's a great honor to be here. Thank you very much for your excellent presentations and welcoming us all here. My question for you is that at this time, I found it really helpful to find out about Friendship Bench Zimbabwe and to learn all about what you do and the way you've been in touch with me. Would you recommend getting other people to sign up to your site kind of almost indiscriminately, just to recommend you to anybody that we think would benefit? Or should we take it a little bit more easy at this time?
So, I mean, I wouldn't like to advise or make a suggestion, but I think it would depend on the people you're thinking of. Like for you, definitely, I'd be like, yes, please sign up, because we've talked a lot.
Yeah,
For
I think
anyone
I
who
signed up.
doesn't-
Yeah.
Thank you. For anyone who doesn't know, Layman Human has a listening bench, and he sadly had to stop because of COVID, but he does sit and talks to passers-by, or tries to. It's a work in progress. It's a work in progress. We'll get there. So yeah, I think it depends on the individual. But I mean, if people have a desire to make a change in their community, we're not asking anything from them. So they really have nothing, they've got nothing to lose. I think people can only gain from this, whether they engage or they don't engage. I think you can't not learn from people, and you can't not learn from resources if they're there. So yeah, I mean, go for it and leave them to make the decision for themselves.
Fantastic. Yeah, there's a few people where that I'm thinking. There's some people who have just qualified and are on a journey of being counselors that I know, and also other people that I just know that I work with, who would really benefit from your approach, and they'd have a lot to learn. So I'll be sending lots of people your way.
Thank you so much.
Thank you, Layman. Leila says, is this platform open to everyone to sign up, or only registered counselors to sign up? Jean?
It is absolutely open to everyone. I think like my qualification for being here is I am not a professional. I am not a professor. I am not a doctor. I am like a community member who's had issues. And so everything I've learned has been from hanging around with doctors and with therapists and with people with problems. So definitely, I would encourage everyone who's not a professional more than I would encourage professionals, to be honest with you. But maybe I'm just biased.
Okay, thank you, Jean. Another question reads, you referred to mindfulness, but no mention of faith or spirituality. Are these significant part of work, for example, relating to churches, mosques, and so on? Maybe Prof can take that.
Sure, I can take that. You know, Friendship Bench is open for everyone, regardless of your faith and your denomination. And what we really emphasize at Friendship Bench is the importance of empathy, you know, the ability to make people feel understood and respected. You know, it cuts through all the differences that we may have, religious differences, racial differences, ethnic differences. And I think at a community level, that is the core. We believe that is the core foundation of bringing people together, connecting people together to make our communities better, and in turn to make the world a better place. So we don't at all discriminate on the basis of faith. And if you speak to the grandmothers, for instance, on the bench, they will accommodate any kind of religion, because the ultimate goal of our grandmothers, which is the ultimate goal of Community Minds, really is to create space for people to share their stories and ultimately make their communities a better place for all.
Thank you, Prof. I hope your question is answered. We have a hand up from Andrew. Andrew, you can go ahead and unmute and ask your question.
Yeah, good morning. Thanks for the presentation and the space that you've provided in development. Our work with Dr. Mposa, who's also in this call, and part of our idea is to support youth in boarding school. because of the challenges. And our population currently is in Kenya. So part of the idea was to look at supporting the teachers who support the students within. So my question was that how appropriate is it to, in terms of how you deal working with the tool that you've just displayed, giving the teachers almost like that particular platform and creating a group within. In other words, instead of each individual having a portal, but having within the school that support, in other words, a site as a school where all the teachers have that particular shared resources and they share some of the experiences within the group. That way you do in, you would have, let's say, a social media platform. But in this case, you're grouping group of teachers within a school site that when they're sharing ideas or experiences that you can be able to support them.
Okay, I think that would take building a different website specific to your teachers, because I think they would obviously have issues that are more internal that they want to deal with and that are not necessarily things that they want to share with everyone. But something we would suggest that we work a lot with is a circle Kubatana Tose, and it's something that all the teachers can come together and share their problems that they're facing. I think there's a huge need for everyone to support one another. And even if there's one head teacher or someone who wants to email us to say, we're having problems with substance abuse in our youth, how do we deal with it? We can give a framework for how to host a circle Kubatana Tose, and then the teachers can work together to solve the problem. And I mean, just like we say, invite community members, invite some of the students into that space to also share what's going on with them. And it could be the best people you learn from are your students more than us, to be honest with you.
Great, thank you, Jean. Another question reads, do you have people with lived experience as some of the peer supporters?
Yes. I mean, when we work with Youth Bench, is it for youth or is it for anyone? Anyone? Anyways, it doesn't matter. Either way, yes. All of our, I mean, what is the level of lived experience we talk about? I think everyone in their own way in life has lived experience to a degree, whether it is chronic depression or whether it's been in times of anxiety or just gone through depression because it's seasonal depression. Everyone's got a bit of lived experience that they can come to. And part of our training with our youth counselors and our grandmothers is learning about it's psychoeducation. So learning about whether it's depression, anxiety, substance abuse, even epilepsy, bipolar. So even if they don't have the lived experience, they get the knowledge that can help them work with people who are living with those conditions.
Great, thank you, Jean. Rory has a hand up, so Rory, you can unmute and ask your question.
Greetings from Scotland, everybody. It's wonderful to be at least partly back in Africa. I've got two small questions. One, could you correct my pronunciation of Kufengistisa? And my second question is, I've been a huge admirer for the past 6 months of all your work out there and the inspiring work of the good professor. And I never stopped telling everybody in Scotland all about this, and particularly with NHS Scotland, and hope for development of preventative medicine in Scotland, particularly in response to COVID. Could I ask you, where'd you get the funding from for this? Do you need any extra help? How's it going on that front? Over to you.
Thank you. Maybe Prof, you can answer that.
Sure. So we often, thank you for that question. And the pronunciation is Kufungisisa, which literally means thinking too much. That is the equivalent of what you probably would call depression in the Western world. See, one of the beauties of the Friendship Bench is we've immersed ourselves in indigenous concepts and terminology. We don't use the language that is normally used in, say, DSM-5 or the ICD-10. You know, we will not talk about depression or psychosis. We use local terms, and local communities resonate more or better with these local terms. Coming on to your second question about how we sustain Friendship Bench, well, literally through a shoestring budget, as they say. You know, that has been our history, you know, and we're always looking for support to keep Friendship Bench running, but mostly to expand Friendship Bench, because the need for Friendship Bench is just huge, not just in Zimbabwe. Right now, we are sitting on 50 requests, you know, plus 50 requests from all over the world, you know, from places like New Zealand, including the United Kingdom, America, you know, in the Middle East, people who want to introduce Friendship Bench, but we just don't have the resources. And in a way, Community Minds is our contribution to the world as the Friendship Bench team, to try and share the lessons that we have learned over the past 10 years of doing this work, so that maybe people from out there, you know, who we can't really help to introduce Friendship Bench because we don't have resources, are able to have some knowledge, some aspects of what we have been doing. So I hope that answers your question. Thank you. And I can see it must be very cold in Scotland from the way you're dressed.
Oh, Professor, you wouldn't believe we've got a force 8 gale here as well.
Great.
Great, thank you. And Prof, I will direct this one to you as well. It reads, are there any policy documents or strategies in Zimbabwe or government-led initiatives to address mental health? If they exist, do you work in partnership or collaborate in any extent?
That's a great question. Yes, we do have policies in Zimbabwe. We have a mental health policy, and we have an MOU, a memorandum of understanding with the government on Friendship Bench. And we have an MOU with a number of institutions as well, tertiary facilities. As Jean mentioned, we have a youth Friendship Bench component that works with universities. So we do have documents that sort of help provide and guide the work that we do. So it's important to advocate for those kind of changes as you do this work, because it has to be integrated in policy for it to be sustainable, hopefully someday. Thank you.
Great, thank you. And the last part of the question reads, do you work in partnership or collaborate with them?
Yes, we do work in partnership with other non-governmental organizations and the government of Zimbabwe. See, our idea, you know, Friendship Bench's idea is to build capacity of other institutions, government-employed staff to deliver this approach. So this is the model that we intend to use in our scale-up strategy or expansion of Friendship Bench, where we train trainers who then go on to train people in their respective communities to introduce Friendship Bench. And we think the ultimate doer at scale for this work is the government, you know, particularly in low and middle-income countries. But obviously, when you look at the Northern Hemisphere, it can be organizations, it can be corporate, you know, it's quite broad.
Great, thank you. I hope your question has been answered. We have a hand up from Kian. I hope I pronounced that well. You can unmute and ask your question.
Nearly, the name is Keen, and I'm in Ireland. In a way, Dr. Shivanda has kind of answered my question. Really, I work in the corporate world, doing wellness programs and initiatives for a huge number of companies. And I'm noticing, because of the pandemic, that there's a massive increase in mental health problems. And my feeling was something like the friendship bench would be really valuable in companies if they were, say, to invite back into the company a previous staff member who may now be a granny. And I just was looking for advice as how would I train these grannies or train people to be available to the corporates, because I see it's the corporates would fund something like this. And has this been done elsewhere?
Yeah, that's a great question. We have been working with private organizations. We are currently working in Kenya, for instance, with a huge tea company. And we are using that kind of model where we empower members or employees of that organization or company to deliver a friendship bench. So it can be done, but as I indicated earlier on, it requires resources, and also it requires capacity building. And we have, apart from the community minds, we have a separate component where we actually look at entities that are interested in that kind of model. But if you go to our website, you can actually see the details on how that is done. But it is very possible. But because Friendship Bench does not have the capacity to go everywhere, this is one of the reasons why we've come up with community minds, because it's an entry point into providing mental health services even within the workplace. We can build communities through this platform. This is the idea that we have. And naturally, with time, if people want to have the full-on Friendship Bench approach, that is something that can be looked into.
Great, thank you. Jean, a question for you. Are you open to collaborations with other mental health professionals in Africa?
Yeah, I mean, absolutely. And I've just been scanning down some other questions, and people have asked about language, both the Zimbabwean asking about Ndebele and just general languages. And if we can collaborate with people and they want to share content, as we've said, we work on a very limited budget, and we've found that professional translators are very expensive. So if there's people in the community who want to volunteer and put their hand up and say, I like this piece of content, can we translate it? We would absolutely, I would work with that person to translate that material with them, to as much as I can, as it's just me. But if we can grow this and we get enough people, there might be someone who joins and they are a designer, and together we can be our own little design team to build out content. It's all, right now, it's all open to what the members can bring. I mean, this is a no budget program, so what members can bring, we'll work with. And I think that's its own community building.
Okay, great. Thank you, Jean. Another question reads, can someone donate a bench, like, for example, the Carol bench, so that when I come to Zimbabwe, I can walk by the Carol bench?
Sweet.
Right?
I'm sure that can happen. Yet I had someone say, can I donate a bench? So you would be the first, and we could make that happen. I'm no doubt about that.
Great. Okay. Another question is, how has the Friendship Bench worked in rural communities? Ideas for this to be successful? Any ideas for this to be successful in small rural towns? Prof?
Thank you. We actually have just recently completed what we call a cluster randomized controlled trial of the Friendship Bench in rural Zaka in Zimbabwe, in Masingo, which actually showed that village health workers were able to treat depression in their communities. So we've done that in Zaka, which is a rural area, and last year we did the same thing in Shurugwe, another rural part of Zimbabwe. So definitely the model can be transferred to a rural setting. We are actually at the moment thinking of expanding the Friendship Bench to rural areas as well. So it's very possible.
Great, thank you. So many questions coming through. Just to state in advance, we might not be able to attend to all questions, but we'll take note of the questions and provide answers to the questions on the Community Minds platform. So let me just go through and see. Somebody asked if I have a registered organization on Mental Health Foundation Trust and would want to know if you can link my organization with like-minded organizations to collaborate in Zimbabwe, if there are any. Jean?
Yeah, I suppose I would say the best way to do that is to get on social media. And I know that's a bit like, it's a hit and a miss, but if your organization has someone on social media and they're following someone who sees are very engaged, it's worth just sending them a message and saying, hi, we're looking to collaborate. We get that a lot, especially with our Youth Bench projects. And often it depends on the resources available at that time. But I would say just put your hand out and ask people. Don't worry about waiting for us to direct you. I think just reach out there and connect.
Great, thank you, Jean. Prof, what are the costs you found when starting the Friendship Bench program?
Can you repeat that question? I didn't hear, sorry.
Sure. What are the costs you found when starting the Friendship Bench program?
So the Friendship Bench has been running for more than 10 years. When it first started, it was run out of pocket. I essentially used my salary as a government psychiatrist to run the first pilot of the Friendship Bench, which was in a place called Mbare with 14 grandmothers. And as I indicated earlier on, we've often had to rely on a shoestring budget to keep things going. But now, as we become bigger and we become an autonomous organization that is registered, we obviously have to think of bringing in the right skill set that help us to take this model to scale. So you're thinking of employing finance managers, program directors, M&E, officers, so we're now really looking at it in a very different way because the demand for Friendship Bench is great, and so we need to be a lot more organized. So the actual startup cost, I can't really give you a precise figure. In the beginning, with only 14 grandmothers, it was probably something like the equivalent of $200 US, but that was really 14 grandmothers. We now have over 700, and we are in more than 100 communities just in Zimbabwe alone. So the cost is pretty high, but unfortunately, I can't give you the cost right now. And I don't know if Lena is on this call. Maybe she might have a better idea of the cost. Yeah.
Okay, great. Lena, would you want to take that up?
Sorry, I was on mute. So just talking about startup costs, we are generally looking at a figure of about 8,600, and this would primarily be for organizations or entities that are wanting to become a doer at scale and adopting the Friendship Bench model and implementing it in their home country. There are related costs in terms of a maintenance or a continuation fee, which is annual. as you're part of a membership with regards to our implementing partners or our doers at scale. And then we also provide quarterly technical assistance to the partner based on need or demand. And so those would be costs associated to it. But I can send an email with the breakdown of the costs once we've captured the individual who has asked the question.
Great, thank you, Lena, for that. So maybe you can just send your email address to Lena via the chat box, and she would be glad to assist you in any way possible. We have a hand up from Margaret. Please feel free to unmute and ask your question. Okay, we can move on to Diana in the meantime. Diana, please feel free to unmute and you can go ahead and ask your question.
Hi, I'm Diana Higuera from the Rocky Mountain Welcome Center in the US. We are in Denver, Colorado. And my question is, where can I find the results of the studies that you have done? I would like to read a little more in depth all the studies that you have done and the results so that I can see if this model will work for us. Thank you.
If you drop your email into the chat, I can send you a link to our website on our publications page where everything we've done up to now is there for you to download.
Thank you.
Pleasure.
Great. Margaret, are you still on?
Hello, can you hear me?
Yes, we can. You can go ahead.
Okay, I just wanted to say thank you for the program, but I just wanted to have some ideas. I'd written a message saying that I think faith leaders should also be incorporated into the friendship bench, given that a number of people in Zimbabwe are a religious people. So people go to church when they talk to pastors, talk to elders. So people tend to spiritualize mental issues instead of just telling someone that they're in depression or they've got a mental condition. Then they quickly get help from professionals. So I think if the friendship bench would try to make use of the women's ministries at churches that are done every Thursdays, every Saturdays, and train these people, because they are patients at home. So it's easier to identify that someone needs help because you know the symptoms. Then my other point is, what about incorporating mental health to be part of the curriculum in the school education system? Just like people know about diabetes, they know about BP from a young age. So I think if also from a young age, if mental health could be incorporated in the education system so that people can know the symptoms and quickly get help before they are very sick. That's my contribution.
Great. Thank you for that contribution. I'm sure Jean and Prof have taken note, and it's something that we can always look into and consider as well. I'll just take one last question that reads, are you open to assist students studying stuff related to mental health? Either Prof or Jean can take this.
I didn't quite get the question, but I'm assuming whether we take students on attachment. If that is the question, yes, we do, but you have to apply. We do get a lot of inquiries, both locally and internationally, and people do come to the friendship bench. And just to go back to the previous question, we actually do work with faith-based organizations. At the moment, we are working with Prison Ministry International, which is a loosely affiliated group of different churches in Zimbabwe, and they are delivering our friendship bench. And with regards to integrating mental health awareness and education in the school curriculum. It's a process, unfortunately. We would love to see that happening. I think we've made our first step by having the Friendship Bench integrated in the strategic plan by the government for the entire country. So hopefully we are moving in the right direction, and we will be seeing not only Friendship Bench, but mental health in general included in the education system.
Thank you, Prof. I think with that question, it brings us to the end of the meeting. It's been an honor to have you all here, and thank you all for participating and the amazing questions that you sent through. We definitely look forward to having you being part of the Community Minds platform. Jean has sent out the link via the chat box on how to sign up if you hadn't already, and please do feel free to share it with as many people as you can. At this moment, I'll just hand over to Prof to give the final remarks. Thank you.
Thank you very much. So really, in short, we are hoping to create a global platform where we all collectively promote the whole idea of showing empathy in our communities. What is empathy? It's the ability to make people feel respected and understood. And it's something that is missing in the world today. The pandemic has contributed significantly to the loss of sense of belonging and purpose in numerous communities. So I see the Community Minds platform as an entry point to rebuild those human connections in our communities and, enable resilience to be the key thing that we have in our communities, to be resilient in the face of adversity. And so we have to, at community level, start to get involved in mental health and not wait until people need to go to the clinic. So once again, thank you all, and really hope you will all register to become part of Community Minds so that we can get onto this journey collectively and make our communities better for all. Thank you.
Thank you, Prof. And once again, thank you, Jean, for such an amazing initiative. We really appreciate you and all the work that you do. Thank you, everyone. Enjoy the rest of your day. Jean, I don't know if you'd want to say something before we close.
No, just a great big thank you to everyone who joined us, whether it's morning, afternoon, night, midnight. Yeah, we will send a recording out, and I will add my email to that. So anyone who feels like they want to be more involved on an in-depth level, I will respond to you. Thank you, everyone.
Great, thank you. Please,
bye.
Bye.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.